Hi guys, Dr. Lester here, and today we're going to be talking a little bit about blood sugar and diabetes. This one's going to be a little bit longer because there's more to this one. So with blood sugar, we already talked about how it starts insulin resistance. There's too much blood sugar. It's not listening to insulin, who tells it to use it or store it. And so it starts getting ignored. Your insulin starts going up. Your brain is freaking out, like, why aren't you listening to this insulin? And there becomes this crazy imbalance, and this is when you start getting diabetes, because now your body doesn't know what to do with all of the sugar because no one's listening to insulin anymore, and everybody's full. So it becomes a chronic battle of like, now I have too much blood sugar, which is scraping up the walls, which is causing high cholesterol, which is then leading to high blood pressure. And all of that is stressing my kidneys because that's way too much pressure and way too much little sharp spiky things tearing at that filter. So that's a problem. And then on top of that, no one's listening to insulin because all of the cells are full because there's blood sugar galore. So no one's listening to insulin. It's going crazy. And now we have a problem of how do we fix diabetes? So the traditional thought with diabetes, and we're going to specifically talk about type 2 diabetes because type 1 is a little bit different, but anything that's insulin dependent, is that we need to put in more insulin so your body recognizes it. Well, that's kind of confusing, right? Because if the body's not listening to insulin and the pancreas is still putting out insulin and the brain is telling the pancreas, like, you just need to put more of that out because we need to get this shit up, like if the body is not listening to that, why would you put in more? Now, the original idea was like to make it the voice of insulin louder, and there might be some validity to that, but it's not really fixing a problem. The problem is the amount of blood sugar in the stream, right? So if we deal with the blood sugar in the stream, then the insulin, actually, we have found from lots of people that get off of insulin over time, and this is a caveat, do not do this without some help. Please pay attention to, you don't get off of long-term medications without help, okay, from a doctor. So with that said, we see people that we take off of insulin because their blood sugar is being well regulated, and they are able to, once your blood sugar starts being managed appropriately and your body can recognize it, then the insulin resistance starts fading away because it actually is listening to the dinner bell. These cells all of a sudden get hungry again because they're not constantly inundated with food. So they're like, oh, I am hungry. When was that dinner bell again? So they start paying attention to insulin. So insulin resistance goes down, blood sugar management gets better. I don't need to be inserting more insulin because that problem is fixing itself. So really, truly, the answer to diabetes is blood sugar management rather than giving more insulin. And this is a problem that we see consistently in diabetics, is that the traditional way of treating this is to make you pee out more of it with things like metformin and whatnot, or to suppress your hunger, which is not necessarily a great plan for that either. Like, you shouldn't stop eating because then we're going into starvation mode. See our video on blood sugar and starvation. That's not necessarily a helpful thing either. And inserting more insulin is not a good answer either. The answer has got to be blood sugar regulation. And this is important with a whole other different array of things, because we're talking about stress management, we're talking about what you're choosing to eat based off of those things, timing of food, the fast-paced lifestyle, all of those things. So it's really a full system problem that needs to be addressed in terms of blood sugar management. But truly, this is how you fix diabetes. And the traditional way we've been going about it is a problem. As a general rule, like I said, you have to do this with a practitioner because this is a very extensive process, and it can be a little bit of a troublesome one if you don't do it appropriately. There are a lot of things that are important with your blood sugar in terms of they keep your brain and your heart going. So don't just do it all willy-nilly. Definitely pay attention and have some help because it could cause some major, major things. If you were starting to feel faint, if you were starting to feel dizzy, if you were starting to vomit, all of these things are signs that you are not managing this appropriately, whether it's too high or too low, and you need help with it. So do not do those things inappropriately. With that said, I hope that helps, and we will talk a little bit more. Thanks, guys.